A very warm welcome to all the participants. That Dr. Gupta needs that introduction, but it is my honor and pleasure to introduce him formally to this group and first of its kind webinar, which is being hosted on HCL Foundation Academy today, taking a comprehensive, I would say, outlook on the COVID-19 pandemic by Dr. S.D. Gupta himself. Dr. S.D. Gupta is a leading public health professional with a distinguished academic and research career. He obtained his MD in preventive and social medicine from India and PhD in epidemiology from Johns Hopkins University, Baltimore, USA. He was conferred Fellowship of Academy of Medical Science, India, FAMS, and his outstanding contribution in the field of public health is known to everyone. He has done pioneering work of creating an established new discipline of health management and promoting research in health policy and health systems and programs. Currently, Dr. S.D. Gupta is Trustee Secretary of the Indian Institute of Health Management Research, IIHMR India, Chairman and Distinguished Professor, IIHMR University, Jaipur. Dr. S.D. Gupta has served as director of IIHMR for 1.5 decades. He became the first president of IIHMR University in 2014. He served as the director of WHO Collaborating Center for District Health Systems at IIHMR, facilitating management research and interventions in the health systems to improve efficiency and effectiveness of healthcare. Dr. Gupta is adjunct professor at the Johns Hopkins University, USA, and visiting professor at University of Chester, UK. He is the president of WHO Southeast Asia Network, Asia Public Health Education Network, SEAPHEIN. Dr. Gupta also served as temporary advisor to CRO WHO on several consultation processes. He was also a member of review panel of the Global Fund. Dr. Gupta is member of several research advisory committees of the Indian Council for Medical Research, ICMR, and chairs Project Review Committee of the Department of Health Research, Ministry of Public Health and Family Welfare, Government of India. It is such a privilege to have you, sir, with us, and it has been my pleasure to read out your introduction, and it's such a pleasure also to let this group know that I am also a student of Dr. S.D. Gupta. We were the first batch that was launched in India of hospital and health management more than 20 years ago. It was his line of thinking that all of us got into the professional field of public health. And I know many students are joining today live with Dr. Gupta, and we remain his students till today. And therefore, I have taken this honor and privilege of introducing him to this group, this room full today, sir. Over to you, sir.
Thank you very much for inviting me to speak to such an august audience. Welcome all the participants in this webinar. So this is epidemiological outlook and its implications in public health in India. I'm going to share with you the global scenario of COVID-19. Global scenario of COVID-19, and then I would like to say something about what this coronavirus is, and then how this virus has traveled to India, and what is the current scenario in India. And I'd like to share with you how does it spread, and what public health measures can be taken to contain the spread. And very importantly, the response of Government of India, how we have responded. I also talk about lockdown and what after lockdown. Let me first share with you the global scenario. What we are facing as of now, this has never happened. What is happening now? This coronavirus is not a new virus. In 1950, we had found this virus, and this was labeled as a new virus at that time. So we know this virus for quite a long time, and it has been coming in various forms. Let me also share with you this coronavirus is generally not seen in human beings. It is in bats and some seafoods or something, but not normal human habitat of this virus. But as of now in the world is facing this for the first time, that such a massive pandemic has occurred. Why we call it as pandemic? When more and more countries are involved, when the virus infection is spread in many countries, then it is called as pandemic. When it is in one country or in one geographic area and there is an increased number of cases of a particular disease as compared to normal presence of the virus or disease, then it is called as epidemic. And there is another situation which we call as endemic. Endemic is a normal, usual presence of the disease continuously at some normal levels. That is called as background infection rates. So the globe is facing is now a pandemic. Means no corner in this world which is not affected. As of now, we have around 2.35 million cases around the world. It's a huge number. And the number of deaths is around 130,000 deaths that have occurred till date in the world. And you will see that which are the most affected countries. You'll be surprised to know the most developed country, I mean to say United States, has the largest number of cases and largest number of deaths have occurred in America. As of now, as of today, about 618,000 cases have occurred and about 26,000 deaths have occurred in the United States. It's a big number. Next was Italy, but we see that Italy's number of cases has slowed down. So number 2 now is Spain. Spain has now 177,000 odd cases of COVID, and deaths are about 18,500 or so. Again, a big number for a small population of Spain. And then Italy. Italy was the major epicenter of this COVID, but it has slowed down somehow in Italy, but the number of deaths has been much more than Spain. The other countries include France and UK, where a large number of cases have occurred. We also see many other countries which are member of European Union. They are afflicted with COVID-19. So it's a kind of a wildfire going around. Europe was epicenter. Now it seems that the epicenter has moved to United States. It could be a very interesting question why United States has such a large number of cases. So where we are, what we have seen in the global scenario, most of the people who are affected were those elderly. Infection rate in the elderly population about the age of 60 years was much higher as compared to younger people, and the recovery rate is very high among young people. Similarly, what happened was there are a lot of asymptomatic cases. We did not know about this earlier. We did not know about this virus among human beings. So we are yet to complete the natural history of the disease. So the world was taken aback when this virus was introduced in the human population. So this is what is happening around. More males are affected than females. This is mainly because of higher exposure to men as compared to women. Not that women are less likely to be affected, but this is because of the higher exposure rates among men. So the epicenter now is in United States. Fortunately, we see a bit of downturn now in Italy and in also Spain, France. We see a small downturn and also in US, but it continues to rage around the world. What about India? This is about India. What do you see in India? Over 12,000 cases. To be precise, 12,370 till last night. And there are 10,000 plus active cases. And about 1,500 have recovered. And the deaths is around 4% people have died due to coronavirus. Elderly people are more vulnerable and the death rates are high in the elderly people, especially with the comorbid conditions like diabetes or heart disease or hypertension or kidney. These people suffering from kidney disorders who are put on dialysis, it's very likely that they are more vulnerable, and you will find that almost 60% of the deaths are occurring among the elderly people, especially with comorbid conditions. This is the situation in Europe and US, UK, but in India, what we are seeing, more of younger people are affected as compared to elderly. Of course, the deaths are occurring more in the elderly, but the infection is occurring more among younger people between 40 to 60 years of age and also other younger groups. This issue is very important, that young people are more affected in India. What do you see is that our mortality rate in India is very low. It's around 3.4% compared to global mortality rates of 6.4%. So this is a significant difference in death rates in India and global mortality. Why this is so? This is mainly because more of younger population has been affected by this virus in India compared to the Western world. And younger people have much more strong immunity, they are free from disease, and their body immune defense system works very well, so they recover. Therefore, if you see the mortality rate due to COVID-19 is almost half of that of what happens around the world. So these are very important facts that we need to really understand. From what is the journey of this virus, from where it has come? This is of interest to know. So what do you see that this virus was first found in human beings in China in December? It's Wuhan city of Hubei province of China. There is a conflict of opinion about. People say that the virus was reported somewhere in late November in China, and China disclosed it only in the second week of January. So it remained silent. China remained silent on COVID epidemic in China, and the world did not know about it. So, but Wuhan is a place, there are a lot of people who go over there from around the world, and mostly these are the people from Italy and some Southeast Asian countries like Thailand, American businessmen. So Wuhan is both industrial town as well as tourist town. So a lot of visitors to Wuhan, and this is where what happened. Wuhan Medical College, there are many Indian students who study over there. Many students study in China, but there were students who were studying in China, and 3 of them brought this infection to Kerala first. So this medical student came from Wuhan. He belonged to Kerala, and there were two other students from Kerala who brought this. So first case was in January 30 in India, and then in the next 2 days there were 2-3 more cases. Whole February we were sitting silent like lame ducks, and we thought it will not come to India, why it should come. But this is what, this happens all the time. Though China is our neighbor, we should have woken up earlier. But still, I would say that India woke up early. Then there's a strong connection between Italy and Wuhan. A lot of Italians go over there. A lot of Wuhan people, they are citizens in Italy. They go, so they come home during their annual festival to Wuhan, like that. So these Italian tourists, and they brought infection in March, and it was in Jaipur, Jodhpur, where we found this. In Delhi, we found this infection. So it started and it continued to rise in India. We did not take notice it seriously. The government of India, of course, started action early, testing, but it still is very low. Testing is still low in India. And wherever you find the testing more, you find more cases. Like in the state of Rajasthan or state of Maharashtra or Tamil Nadu, you see more cases of COVID. The reason being that testing is more. And then you know about this religious congregation. So we had quite a low level of numbers of cases in India till mid-March, maybe around 400, 500 cases only. Thought that in a country of 1.35 billion, if there are 400-500 cases, it's just minuscule. We should not worry about. But the booster came in when there's a religious congregation of 5,000-6,000 people, and then later on it was found there almost 30% of them, 40% of them were found to be infected. And this spread over the country in different states. They spread around in 22 states in India. And then you see the whole story. So we didn't have, on March, realizing the seriousness and increased number of cases, all of a sudden, so Government of India, as you all know, announced lockdown, national lockdown. I have listed something in this. This is scenario of Rajasthan. Rajasthan had a very small number of cases, but all of a sudden there was a blast, you can say, in the number of cases. And this is the community in the walled city, Ramganj, where it became a hotbed of the virus. You might have heard about what happened in Mumbai, and so long it was in the suburban areas, it was fine. But the moment we found cases of COVID in Dharavi, then it sent the warning signals, alarming situation started. And now you see the most affected state is Maharashtra. Next is, I think, Tamil Nadu. Tamil Nadu is number 2. Rajasthan has also now come in the rankings, I think, and then the other states, Delhi, Madhya Pradesh, Gujarat, Uttar Pradesh, these are all states that, and maximum deaths have occurred in Mumbai or Maharashtra, you can say, and next is Delhi as far as deaths are concerned. The deaths are very low in some of the states, including Rajasthan. If you compare with Mumbai, Mumbai started surging late after Rajasthan, but it is now 3 times of Rajasthan numbers, and Rajasthan has been able to contain the number of deaths due to COVID. This was interesting from epidemiologic point of view and public health point of view, why the mortality is low in Rajasthan. And then there are other states where the mortality is low. What we are seeing, there has been a continuous rise in the total number of cases in India. As I said, it continues to increase. But if you look at the daily new cases, we are seeing a small downturn in the new cases in India. And then if you look at the number of active cases and all that, there is again, we see a small dip in active cases and we see a recovery. The deaths are also showing a declining trend in the last 2 weeks. So this is something important trends that we see now in India. The question is why India has a small number of cases. So this, you can see in this slide how the response, but you will like to see that starting from, it's back to 30th January, but so then see this February, there was a meeting of the cabinet and the states, and this is where, and then on 13th of February, they started screening at the airports and seaports. They thought that the infection is coming from outside, especially China. They stopped people from China and the affected countries. And then they went for universal screening at the airports. The Prime Minister of India reviewed the preparedness of India. You know why this became a cause of worry to the whole world? Because of the rapidness or the speed with which the epidemic was growing fast. You have seen SARS, you have seen MERS, you have seen swine flu, and you have seen HIV. So we never had a treatment for all those diseases which I have mentioned, and there was no vaccine against them. But the good thing about them was they were not spreading fast as this coronavirus has spread. The speed at which it spread, it multiplied, that is something worrisome. And then the mortality rates were higher in coronavirus as compared to other. Typically for HIV also, it was a viral disease and we knew that we had no treatment for it. We could never develop a vaccine against it. And it was taken like that once you have HIV, you will have AIDS and finally you have to die. But it takes 8 to 15 years to die with HIV. But for COVID, it might take 3 days only once you are infected and you have comorbid conditions. We don't have treatment. We don't have a vaccine in COVID as well. But it is the short duration of incubation, short duration of disease, and severity of acute respiratory infection like pneumonia. Oh, pneumonia occurs quite frequently, but it doesn't kill that much because if you give antibiotics, it's all right. But if it is due to viral pneumonitis and the secretions get stuck in the lungs and it's very difficult to clear. So this happens and finally you go into breathlessness and all that happens in the death process. So that's why this corona became worrisome, why the world was so worried. And then there were many mathematicians who came with models and they showed horrifying figures for future. For India also, you might have heard many mathematical models were proposed and they said that there'll be so many lakhs of cases in India and how many will die. They all made projections. But I don't want to comment on those models. I also developed models, but I did not share with anybody. What they did not factor in their model is the social distancing and hand washing. If you start that in a disease where there is no vaccine or no treatment, this distancing and isolating cases and putting people on quarantine, those who have come in contact, and then protection by hand washing and not touching face, and social distancing, don't go into the crowded places. That's what it is. So don't shake hands, don't hug. This is what social distancing is. So they did not factor in their models these things. And therefore, they were simply mathematical projections. There was no human biology involved in that. And no interventions were factored in. Anyway, the purpose is not to criticize, but I also want to make it clear, we need not be horrified with those graphs. These will change. Anyway, so finally, 24th March, the Prime Minister announced the national lockdown because the social distancing and hand washing was not being very much practiced. We didn't see the cooperation of people. So this national lockdown was seen as one of the important and only measure at that point of time to slow down the spread of the virus, and maybe we buy time for developing some interventions or maybe vaccine, or the virus may die down after 6 to 8 weeks. We were just presuming that this will happen. But what happened then, so rest is that now we have second lockdown 2.0, and this is up to 3rd May. On 20th April, it will be reviewed. And the government of India has come up with a policy that they have decided the districts which are hotspots. They have decided the districts which were moderate, and there are districts which have been put in green zone. So in all, about 170 districts in India out of 650 have been put in this hotspots, and this whole intervention of lockdown and all those things that have been closed, and all interventions will continue to be followed. The next level, where the infection or the number of cases is small, this lockdown may be modified. And then those which are green, there is no infection, then they will go for a larger freedom of control systems. So this is what happened in India after. So you might see that from January 30 to months' time, starting from February, late February till March 24, so almost 1 month, we kept on watching the trends, and finally, so you will see that when the graph started rising, the government of India responded very strongly. And in fact, I was interviewed by New York Times, and what I said, India will beat this. Why it will beat? Because the system has great resilience. It may not be effective and efficient, but in times of emergency, it comes back with great vengeance and power. We have seen tornadoes, we have seen cyclones, we have seen smallpox, we have seen polio. We all blunted them. That's what statement I made in New York Times. So we will do this. This lockdown has really made a sense. So people have questions. Why lockdown? Let me tell you. And why India has such a low number of cases as compared to Europe or China or US or UK. I think all these countries woke up or did not think that the virus will create such a havoc in those countries. India was wise enough and they went for early lockdown. I like to give you some example. So they didn't go for lockdown. Italy went for lockdown when it became a full-blown epidemic in Italy. So also Spain. They didn't want to lose their tourist income. Their 12% of GDP comes from tourist income. So they didn't want to do that, and they didn't put the country into lockdown and kept on saying social distancing and all that, but in fact they did not. So, and same stories with the United States. But India, when it had a number of cases around 650 in US, say California, there were 13,000 cases in US, and the total cases. So you can see India had only 650 cases, and they had around 14,000 cases. Still, they didn't go for lockdown. India went early into the lockdown. People may say that we have not tested enough, therefore we don't have enough of the positive cases. I think this question is very valid. But India has tested more than now any small country. And the effect of the lockdown is, like United States has now 640,000 cases, and India has around 12,000 cases. One of the reasons could be, this could be attributed to the lockdown, which forced distancing, physical distancing and social distancing, and promotion of hand washing and wearing masks. You know, people come up in a staggered manner with the interventions. Earlier, people used to say, oh, there is no need of mask. Now they are saying, no, everybody should wear mask. If not mask, put a cloth around your face. This is what they are talking about. So this lockdown had we not had lockdown, what could be the number of cases in India? Any guess? The number of cases would have been more than 800,000 in India if there was no lockdown. Now, what we are doing now further, in addition to lockdown, there was a big debate going on that shall we go for the lockdown or lift the lockdown. So lot of rumors that it will be lifted on 14th of April. And some people, the government of India asked the states to prepare lockdown exit strategies. And Rajasthan also prepared. I was on the committee on lockdown strategy of the government of Rajasthan. We proposed that it could be a graded lockdown upliftment. Those which are hotspot should continue under lockdown, and then which are moderate, we can open up some services. And those who are having no cases, this lockdown can be lifted. But the inter-district movement and interstate movement should continue to be restricted. That's what most of the states said like that. So what the Prime Minister announced on 13th of April, the lockdown has been extended. It was felt that lockdown is necessary. I believe the lockdown was, I would say it was effective around 60%. We needed much more effectiveness, and that will come by extending the lockdown. So on 20th April, the government is going to review the situation. Districts which are hot spots, as I said earlier, 170 districts have been identified as hot spots. They will continue to be under lockdown till May 3rd. These districts which are moderate in infections or there is no infection, there are around 140 districts where there is no infection of COVID. So a differential strategy will be followed for them. So this is how and where we are. I can share with you some interesting cases. So what should be the strategy? People ask us today, Again, we had this meeting today of the advisory committee. And the key question by the bureaucrats and politicians was, now what we do? Tell us, Dr. Gupta and company, we have done whatever you said. Still the number of cases are rising. What we should do now? I said test, track and quarantine the contacts and isolate the cases, treat them. But what I did for last 4 days, we were trying to do a random cluster sampling. So we have got the results today. Okay, so this is this interesting story because the big question today is what to do now. It is still rising. So the main strategies have been testing, isolate the cases, treat them, though there is no treatment. But at least they will not spread the infection if you isolate them in the hospital. Now, so hospital preparedness is very, very important. For if you have large number of cases, hospitals do not have that strength, not so many beds. So the bed strength had to be created, and the governments have been asked in various states to increase their bed strengths and necessary ICU arrangements that for isolated or diagnosed cases. Next is quarantine the contacts of those cases. Now the problem comes where to quarantine them. So isolation is done for those who have the disease. Quarantine is the term used for those who do not have the disease but have come in contact. They are healthy people, likely or have the risk of developing infection. That is quarantine, and we observe them over a period of time whether they develop the disease or not. So minimum time is 14 days. So in 14 days, if they don't develop the disease, 14 days is said to be the longest incubation period of COVID. So for that period, they are quarantined and they are observed closely. But we faced problems where to quarantine them. So a lot of schools, colleges, guest houses were arranged. But they were not interested in going for quarantine. You must be watching TV and how community is reacting to, and there's a lot of violence against medical teams and even police. So surveillance and containment are the next things. Social distancing comes as one of the containment measures. Don't allow infection to be spread, because this infection is spread by contact. I think some of the myths need to be removed. It doesn't spread by airborne transmission. It doesn't spread by food. It spreads only by contact transmission or droplets. You might have heard about droplets. Droplets and droplet nuclei. There are two types of droplets. These droplet nuclei are very, very small, fine particles. When you sneeze or cough, they become airborne in the environment around you. But the droplets are heavier, and corona is heavier and larger. So they settle on the surface. Or if you are in the vicinity of the person within 3 or 4 feet of it, it can settle on the surface of your body or on mucous membranes of eyes or nose or your mouth. This is where entry point is. So this droplet infection and contact is the mode of transmission. Therefore, social distancing was required. Social distancing is around 70% effective. And if it is complemented by hand washing, you can add another 20%. So 90% effectiveness in preventing spread by simple social distancing and hand washing. And maybe now mask. Mask is generally recommended for the medical practitioners or healthcare workers, or maybe even police people who are now actively going with the medical team, so they should be protected from exposure. But now the new recommendation has come in that the general people should also use some mouth cover, not necessarily N95 mask or surgical mask, but they can use some cloth or even handkerchief to cover their mouth. Anyway, what I was telling you, Ramganj story, this is the hot spot. Out of the total 400 cases in Rajasthan, 300 are from Ramganj area. And what is this Ramganj area? These green spots you see are the hot spots where these 300 cases are concentrated. And the population is around, of this whole locality, around 2 lakhs. We did a random sample survey or random cluster survey that finished. So our positivity rate from this testing from the cases and contacts, the positivity rate was around 10%. We suggested to government, we have to ensure and see that there is no community spread or transmission, or it is there. So we suggested, let's go for random cluster sample, and today we got. So it is now 6.2% of prevalence rate in random samples. And this cluster sample included 2 or 3 of the hot spots. If you exclude them, then the rate should come to 2%. So the community spread is not that much evident. So the disease is still confined into the walled city. And now what is our strategy now in Ramganj is to focus on testing, identifying new cases and contain them and do social distancing and hand washing. Kerala was one of the states which started wildfire. It was on the top 10 days back. So what has happened all of a sudden, it's out of top 5. It's not even in top 10. What was done in Kerala? What was done in Bhilwara, which was a hot spot, hot district? I mean, these are some of the things that we need to understand. And we are trying to do the same thing in this Ramganj. There are 2 more green spots, which are hot spots, which have been added today. So what we did in Bhilwara, or what is being done in Kerala, massive screening, house-to-house screening through this thermal screening. And those who are found to have fever or cough or ALI, they were tested for COVID, and when found for positive for the disease, they were isolated. Their all contacts were quarantined and they were kept under strong vigil of these people. So, I would say in Bhilwara district, we tested, we screened 24 lakh people by going house to house in the entire district. So they could know. And it is very important to find out source of infection, from where it is coming. So it was the doctor who got infected while treating some patient, and it was a private hospital. And he remained asymptomatic for quite some time, and he kept on examining patient. The problem came in when when the doctor was tested and found to be positive. Then the whole trail started. But they succeeded in containing the spread of the disease. And finally, now for last 2 weeks, no cases reported from Bhilwara district. And so is from Kerala. They adopted the same thing what was done in Bhilwara. They did testing, they isolated cases, they quarantined contacts, social distancing. Kerala is now not a state that reporting many cases. It's Maharashtra, it's Delhi, it's Tamil Nadu, it's Rajasthan, which are reporting more cases. So what is required is that the tests that have been done, and you have positive, and you did testing among the symptomatics, those who had symptoms, and those who were found positive, then their contacts. What is required now? Testing in the community. So you can know whether the virus has moved into or transmitted into the community. And if that happens, then we are in trouble. So we have to stop community spread by any means. You may have to pay a very heavy price. This lockdown extended simply for the reason it should not spread in the community. But we have to continue testing, isolate cases, treat them, and track those who are in contact, put them in quarantine. That's what is required at this point of time. Extension of lockdown is well justified. Now, the other things like logistics that the government must manage and should manage. We don't have shortage of milk. We don't have shortage of normal groceries. So we have to bear with it.
So how is the progress on vaccine? Is there any news from any part of the world?
There are 4 countries that are trying vaccine: Germany, US, China, and India. They have been able to characterize virus. They have been able to isolate the protein material of the virus. So they are in the process of phase 1 trials. Still, it will take time, about 10 months' time, when the vaccine will be available at commercial level, whether this is United States or India. But good thing is this: the government of India has become very liberal in giving permission, whether these are pharmaceutical products or these are experiments or these are vaccine development activities. They are now quite open and quick in responding to requests. It could have been done earlier if China had shared the genomics of virus. But when the virus reached in US and in Germany, then they were able to isolate the virus and extract the protein material which constitutes the virus. Virus is not a living thing. It's just a protein material enveloped.
There is an interesting question here from Mr. Prabal Sen, and he's saying that people also are showing asymptomatic behavior, like there is an asymptomatic behavior of this virus, and when they were tested, they were found positive. Is that true? There's one more question, which is also, kind of curiosity and anxiety that people have, that lockdown has to be, on one fine day, it would need to be lifted. And what then? Especially in a country like ours, which is so heavily populated. Surbhi was also asking, and a lot of people have actually asked a question on lockdown. Third question, and I stopped there, that there are a lot of states which are not reporting. Is that true, that they are not even revealing the numbers or not even attempting to test?
So there are 3 questions. First is on asymptomatics. Our recent community-based random sample survey showed that around 90% of those who were found positive, we found 9% or 6% positive. Of them, 90% were asymptomatic. Community, living in the household without any symptoms. So they are a continuous source for spread. Since the disease is mild, so they are not requiring any admission. So it's a big dilemma. What to do with them? We should do a stronger lock-in of these asymptomatics. They should not come out. They should remain confined, and they have already done the damage. Lock them in and don't let them come out. That's it. So that this infection does not spread. And continue our testing. Second was about lockdown. People think that it will come back to square one, but this is also possible. That the maximum incubation period of the COVID is 14 days, 2 to 14 days, and the median incubation period is 6 days. So if you have repeated cycles of median incubation period over 4 or 5 weeks, so we have to really see that we will be in the lockdown for 6 to 7 weeks. And we believe if there are no contacts during, so the cycle will be broken. If you have 5 cycles of median incubation period, so all the last 2 generations will be done with. And I have already shared with you that America did not do lockdown, Italy did not do lockdown, UK did not do lockdown, Spain did not do lockdown. And what is their situation? India did its lockdown when there were only 600 cases, and you see we have barely reached 12,000. In such a big country, you may say that you have not done enough testing. And this is the answer to your third question. That if you do testing, you will report. If you are not doing testing, how you will report? States which you didn't want to name, they have started testing, and you will hear about that.
So, what is your guidance on PPE, especially for the doctors and the medical staff, also police, which is coming in direct contact with the COVID patients?
This PPE is must. Since this started all of a sudden in the first 4 weeks, the country, I must say, was not prepared. So this situation became much perceptible after lockdown. There were not enough PPEs. But I think that problem is solved now. And there are many who have started manufacturing PPEs. We'll need them in large numbers over a period of time. A good thing is that the government has described already the guidelines for PPE use, as well as manufacturers' specifications. And important, we need to consider those who directly handle the patients in hospital. There are separate wards for corona, so they use PPE. Like, the resident doctors and all, where this corona patients taken. There is a roster of 3 shifts, and every time, every day, you need PPE. This all, you cannot use it second time. So that's why it is a continuous process. The CSOs must negotiate with the government, and they must think of producing PPE of good quality. It will be required for many months. Demand for this will not go down for next 3 to 4 months.
Thank you so much, sir. It's a pleasure having you here with us today. We have so many questions in the chat box. What we'll do is we'll also make a note from them and consolidate them and send the list to you.
Sure.
Perhaps that would help also to understand what kind of curiosity and what kind of questions people have.
Okay, that's fine with me. But today what we found in our cluster survey, that 2 new hotspots in the area. And we are just struggling with what to do with this because the number of cases is rising.
So, sir, we have Dr. Amit Kumar Gupta from SEL Healthcare. He has this question from you. He wants that you should throw some light on psychosocial ramifications of the extended lockdown and how to cope up with that.
Oh yes, it's a very, very important question. We are confined to homes for last 21 days, and we are likely to continue to be in home confinement. There's a lot of anxiety among people. There may be many who may come with depression. Because remaining in home all the time, people may go into depression. These are the 2 things that we see that may, the psychosocial or the mental health problems that may come in. Some of the mental health problems may also get exaggerated, just like this compulsive depressive disorders and maybe schizophrenia. But most important are anxiety, neurosis, and depression.
So there is a very interesting question. It is from Dr. Santosh Kumar. Sir, as an epidemiologist, what do you think COVID is going to have its impact on economy of India and also on future healthcare system in India?
Now, the economists are on job. It is predicted. We should not think it away that there will be no economic slowdown. It will be there. How much it will be there and how it is going to affect. And my understanding is that it's going to affect more poor than people in the higher middle class and higher classes. But poor will be the most affected. Since you people work on inequities, this will be a big challenge for you, that it is going to increase economic inequities and social inequities. That's one part of the story. And we have to go back to basics of health systems. We need to work on increasing their strength. We need to support them with adequate logistics and supply. We need to build their capacity. Already, health systems were required to transform to address the challenge of non-communicable diseases. Our health systems were primarily designed for maternal child health and acute communicable diseases. And when this transition to non-communicable diseases, our systems were not ready and still not ready. Meanwhile, this challenge has come up. So the health systems are greatly burdened. A good number of people are health functionaries or health workforce are getting infection. But from the system's design change, it would be necessary that we align to our future needs. As far as this COVID infection is concerned, at the moment what we require is strengthen the system with the skill sets, increase their number, protect them, and good supply of kits and other material.
We can thank Dr. Gupta for giving such a, I would say, deep insight into this pandemic, while keeping it also very light for the kind of participants that we have from all walks of life here. On behalf of HCL Foundation team, HCL family, overall, we have taken a consolidated and a coordinated action towards COVID-19 response, starting from our commitment on ventilators in Tamil Nadu. Of course, delivery is weak, but we've committed more than 500 ventilators in Tamil Nadu. We have committed 100,000 PPEs in Uttar Pradesh. Our technology is being used extensively. There is a coordinated command center in Noida with the district administration. As we speak, a war room is being set up in Tamil Nadu, in Chennai, with the relief commissioner. Also, a very unique model which we have set up in Bangalore, Karnataka government, the Ministry of Health. They are going to deploy nursing staff, and a telemedicine model is being set up from our own premises, such that direct contact with the paramedics and medic staff can be reduced. Of course, food program, food security, animal welfare, all of that is on from the larger HCL, I would say, coordinated response, where the entire company and the group has come together. Not only HCL Foundation, but also Shiv Nadar Foundation and the HCL bigger group. So we are all at it, and we'll keep inviting you, sir.
Thank you so much.